Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. The pain, how long has been going on?
About a year.
A year ago. Did you have any accidents, falls, or anything?
I fell down the steps.
Okay.
Well, 3 steps.
Okay.
Twice.
So when you
at the same time. Well, the same hour.
Oh, you failed, and you decided to go back to the same steps, and you fell again, or?
Yeah.
Okay.
Well, I didn't know I was going to fall again.
All right.
But I hit the rug and the
Was
and
that
the rug
slippery or
went.
something like that?
Yeah.
Or you have a poor balance.
No. She had waxed an area that I didn't know. She had waxed and the rug went.
And you landed on the body.
And I landed on my back and my head.
Did you lose conscious?
No.
So you landed here. What's happened here? So you slide all the way this way.
Mm-hmm. Well, it was the bottom step, okay? And I hit the rug, and I fell back. I guess it didn't fall down 3 steps. That's incorrect.
So
she fell back. Hit the rug and hit the
both
back
of them
my
in
head.
the exact fall?
Yeah.
Okay, that was a year ago. And how did you feel after that? The pain in the back here and the pain in the neck, or just in your back?
Just sore.
In the back. How much pain from 0 to 10?
At the time?
Yeah.
8 maybe.
Okay, what about now? Can you give me updates? What's going on now?
It's starting to really all of the time.
Okay, so it's constant.
Where it wasn't before.
Okay, so it's getting worse, like constant. And you feel it in here or down in here?
No, it's right there.
So it's like the iliac crest, just this spot.
Mm-hmm.
Okay, what's difficult for you to do because of this condition? Walking
for a long time.
For a long time.
Yeah, which interferes with shopping.
Okay,
that's serious stuff.
That's tough one. You need to get back to shopping, okay?
Yeah.
You've been on the budget.
But really, I think walking aggravates it the most.
Yeah.
If I'm standing
Shopping
for a long time.
aggravated?
Yes.
Or it depends on how much you spend with shopping.
No, just the walking.
Just the walking.
Yeah. And standing.
Standing. Okay. Have you, for the last year, have you had any treatment for that? No treatment. Okay. Can you describe your pain? Is it sharp, dull, aching? How you describe that pain?
It starts out dull, and then the longer I walk
or stand,
it becomes sharp. I mean, really aggressive.
Sharp.
Yeah.
All right. So let's actually stand or walk a little bit. We'll have you and tell me. Let's aggravate a little bit. Let's actually bend forwards. We'll have you stand here. Sorry.
And bend forward.
Yeah, and tell me how that feels. Oh, you're flexible.
That's okay.
That's a good range of motion. Good job. Yeah, that's nice. Are you like hypermobile? Okay. The other way. So twisting was. What's happening?
That hurt. Ooh, that hurt right there.
Okay. Have you had any stomach surgery?
No.
Muscle spasm? Sorry. How's that? You jumped. What happened? You feel the tightness? That's very tight. It's really tight. There you go. Make sure it's not too much. Okay. But this is a spot. You have a scar tissue. I'm gonna work on it. I just wanted to release other areas around here. Problem is when you have too much scar tissue that the body does not get rid of it. So that's when you start to have issue, and you feel this knot here, that bump, that's a scar tissue. So that is that's what we want to break it down. That is the size is like tennis ball.
Yep.
And it like in the center, I can feel like actually. You feel like a little bit rock inside. That's what I feel. You feel that? She feels it, it's easy to feel it with those tools. Here. And that's the spot you have trouble with, yeah?
Right. Yeah. Exactly.
Yeah. So You see, everything is okay around it here. Here is a little bit too much.
Yeah.
Okay, don't kick, okay? Here it's not too bad as this spot.
Yes,
and that's a
yes.
spot that she complained of pain around this area. How's that?
Honestly, it is gone.
Beautiful. That's good.
I mean,
And you had muscle
I
spasm with the
I
twisting.
could poke like that and it would just,
Okay. How's that?
better. I didn't do that.
Yeah, beautiful.
Okay.
It's a lot of scar tissue in the back. Okay. How you feel? Can you tell the difference?
This is a lot better.
Mhm.
This is better.
That's good.
I'm very impressed here.
Yeah, awesome.
I mean, this hasn't gone away for,
A year. Yeah.
well, it just kept getting worse.
Yeah.
The more I
constant
walk.
pain, that's annoying.
Yeah.
Yeah, I'm glad you're doing better.
Yeah.
Thank you.
It's gone. This is gone.
Beautiful.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.